The first speaker in the Active Innovation session is Clemens from SAP.
This is a slide without any text, but I think it shows the problem of healthcare very, very well. Because this is basically what we are all confronted with. If I visit the hospital, I'm a PhD in biology, by the way, so I have a lot of affinity for the medical industry and healthcare. If I visit a hospital, you notice that a lot of the data is still collected on paper, in Excel sheets, and in many other different formats. And this is very unusual, but because the other industries that we from SAP are dealing with, they are moving ahead with digitalization at rocket speed. There are significant barriers why digitalization in healthcare is not happening at such a rapid speed. The roadblocks are that it is difficult to get access to the right kind of data. The data has to be anonymized. We heard there are data privacy difficulties and challenges and so on. It is very hard to collaborate on the data. The difficulty is also that many people in the medical profession are very, very busy. They want to talk to patients and they have no interest to really work and to get to know EHR systems, for instance. There are not that many meaningful applications that a physician, for instance, or somebody in life science research can use that are very intuitive, that they like to use, right? You really have to create solutions that people love to use. The other thing that we hear is many of the solutions are black box algorithms. People do not really know what is happening behind the scenes if some analysis is taking place. And this is, of course, especially important for medical doctors because they always want to know, if I talk to a patient, what is actually happening? How can I give this patient the best advice? And as I mentioned before, we have privacy, compliancy, and security issues as well. And finally, there is a lot of talk about patient engagement. And I think all of us know, for instance, the iPhone, it's almost a medical device. And there are thousands of apps that you can already download from iTunes, right? Patient applications. But still the patient engagement is not fully tailored yet to the patient and to the physician. It's not that negative. Gutenberg, of course, invented the book press, and this changed everything. And we see the same happening in healthcare at the moment. Why is that? Why can we make that statement? We heard it today from Sophia Genetics. The cost of sequencing a genome has dropped by a factor of 1 million in about 10 years. Absolutely amazing. That means every one of us can get the genome sequenced. We have more and more mobile devices that all of us are using. I have about 3 of these in the meantime. And they help us to track how we are doing. We saw a couple of good examples during this session as well. The key thing is that CancerLink is an organization, a company that was founded by the American Society of Clinical Oncology. And ASCO has about 45,000 oncologists worldwide as members. And these oncologists said, we have a challenge because I'm sitting somewhere in my office and I don't have a colleague that I can talk to, but I need their information to learn from them how I can actually improve my treatment of my patients. So ASCO then decided, with the help of the contributions that these members pay, to create the company CancerLink, and CancerLink, on top of the SAP HANA technology, built this exciting platform that allows oncologists to learn from one another, to communicate and collaborate with one another. Another point that is very exciting, where ASCO said we need help from SAP, is to look at something which we call clinical quality. If you think about a physician who is working with certain patients, let's say with a lung cancer patients, and this physician is checking how is the quality of my treatment, how is that in comparison to my peers. This oncologist would like to see this information in an easy to interpret dashboard. This kind of dashboard is adjustable for any kind of quality measure. So you can also look at how are the payments going? How much money do we get back from the insurance? Different kinds of treatments, etc., etc. I talked now about how we can collect or how we can combine data from many different resources. But of course, there are other solutions that you can think about as well. And one of them is around health engagement. So what we have created is also a second kind of platform that is disease agnostic, you could say. So you can use it for any kind of diagnosis. You can use this for prevention for diseases, etc. And this is a kind of application where through, for instance, a smartphone or a medical device, a patient can interact directly with their physician, with researchers, or with program directors. So what is SAP's basic strategy and what is our product portfolio that supports this? Now, at the basis of everything that we do is SAP HANA. SAP HANA is an in-memory database technology, although it goes far beyond that. It is a high-speed, real-time, in-memory analytics service. And this database allows you to really look at huge amounts of patients. For instance, we are looking at cohorts with more than 1 million patients, slicing and dicing these patients or these patient cohorts across 60 to 70 different characteristics that each patient has. And if you start to do that kind of analytics, of course you need something that is really, really fast. And that is what SAP HANA allows you, because with this kind of application you can get the answers within seconds. You don't need to wait for 2 minutes to get the analysis back. The other thing that is very important is that you cannot start creating huge clinical data warehouses anymore, because you heard today a couple of times already that the amount of data is simply exploding. So you have to start looking at what we call federation. You really have to start thinking about intelligent ways that the data stays in the different locations, but for instance that you send federated queries to those locations to then collect the answers. For everything that we do at SAP and with our partners, we always say it is absolutely crucial that the patient is in the center. We have to keep the patient in the center and really think, how can we jointly help the patient? And we are not only talking about the patient outcomes. If we put the patient in the center, we also talk about the patient's concerns around data privacy, so that we also have that always top of mind. Everybody has his different interests and everybody needs his own business model. And that is, of course, what this platform should definitely enable. And then, of course, the patient in the center has one very clear interest. The patient wants to stay healthy and wants to get the support from all the different stakeholders in this network.